36 states, the best of the United States of America.
Happy Friday, Baylor College of Medicine and friends of Baylor. Well, it's the Olympic Games. How exciting, those 5 rings, surprisingly enough, and a little COVID virus to tag along. And one of my favorite thing is, how did the French come up with the illuminated globe that looks like a COVID virus attaching to a cell? I thought that was very, very creative. They're known for their creativity. And so as we did the last Olympiad, medal counts. The Australians have 5 women, water polo players, who have tested positive for COVID so far. Who knows, there may be more. And what's great is they've come up with some really unique ways to deal with it. They've decided to isolate them and put masks on people. The creativity never ends. Unlike in Tokyo, if you'll recall, where everybody was isolated in a bubble and they were very careful. No one's caring much about it. But that's not all, of course. There's the concern that dengue may be around in France. And there's not a lot of COVID in France right now except for the Australians. So this is what's happening in the U.S. It's going up a little. France, there's not a lot. But, you know, like in Tokyo, the athletes are probably going to introduce COVID. But as I mentioned, dengue is also a concern. And why? Because they have a unique problem. They have an invasive mosquito called the tiger mosquito. That's Aedes albopictus, which is the nastiest looking mosquito I have ever seen to date. And that one transmits dengue. And of course, what's amazing is obviously hot weather makes it worse. So it's the hottest time in Europe. Mosquitoes' metabolism increases. They actually mature faster, become adults faster, and therefore bite more. And so the problem is they're very concerned that dengue may actually break out because of the Olympic Games. Usually dengue is a mild disease, mild febrile illness, sometimes it's asymptomatic, but some people have died from dengue, and very few Europeans have been exposed to it. So this is mostly a disease of the Americas and Southeast Asia. So the vaccines aren't really available to that much. They're usually restricted to places like Brazil and the countries that have a high level of disease. So they've been doing mosquito traps across France, 526 traps, and they're looking, and hopefully they're trying to eliminate mosquitoes. That's their goal. But as I said, it's really not that common in France, but they're very concerned that it might break out. Now, in other news besides the Olympics, sort of some bad news and some good news. The bad news is, of course, global measles continues to be a problem because people are not vaccinating like they used to. There was a huge spike in 2019 globally of 140%, and Poland has seen its surge in cases since 2023 because of the drop in vaccination. And of course, in the United States, there's been a case in Boston for the first time since 2020. So again, this is all based on the fact that when we talked about the R number, a very high number, R number with measles, in order to have sort of herd immunity, to keep the virus down, naturally you need 95% of the population vaccinated. And as more and more people refuse vaccination, we're going to have outbreaks in measles. And I reviewed measles as a disease a few weeks ago. Now, one of the coolest things, there's another ongoing pandemic, HIV. It hasn't gone away. There's about 40 million people worldwide who are infected. But Gilead just released some data on twice-a-year lenacapavir, which is directed to a new target, which is the capsid. The capsid surrounds the nucleic acid in the virus. It provided 100% protection for women and girls. So this is a huge advance because in those countries that still have a high prevalence of HIV, you can protect the female population, and it can be generated fairly inexpensively. So this is a really great potential new treatment. And as I mentioned, in sub-Saharan Africa, there's still people dying from HIV. If you look at Lesotho, Eswatini, Botswana, this is in death rate per 100,000, and you can see it's 200, 300, 400 per 100,000. So there's still a lot of people dying from that disease. So anything that could help reduce the prevalence, like a preventive, is a huge advance. So congratulations to Gilead, and hopefully that'll help these countries eliminate HIV. Of course, the biggest problem right now in the summer for us is heat. And temperatures in Arizona are up to 120 degrees. There have been 322 deaths. They're heat-related. This is mostly a problem of the folks who are homeless. They have no protection, and it's a real problem. In June, there were 38 million people in the United States who were exposed to high heat alerts. That doubled in July. And if you look at June, the purple is where there's high risk for health-related illness from heat. This is a little bit in the Pacific Northwest and in Arizona and Los Angeles. But now, if you look at, there's a high dome of pressure over the central part of America, and a huge number of states are really at high risk. And they include Kansas, Nebraska, Missouri, Tennessee, Alabama, Mississippi, Texas, and New Mexico. So lots of real heat-related illness. This is now a publication from the government, United States government. This is the number of ED visits due to heat-related illness. And you can see, I mean, it's pretty substantial, and it correlates with those areas of high heat. And there's even a thing that the not the CDC, but the government is printing out called the Heat and Health Index. That takes into account not only the heat index, but also the community response to heat and sort of access to care, homeless population. And you can see the dark red is the highest top 10% risk. And while that it's not exactly the same as that heat map I showed you, but for example, most of Texas is in really high risk areas, New Mexico, Arizona, Nevada. So, you know, it's going to be a real problem through the rest of the summer and in the future with heat-related illness. More deaths occurred in Europe because they don't have air conditioning. You know, in general, air conditioning is broadly available in the United States, but it's not in Europe. So let's do a COVID update. Big surge in COVID as we approach the fall. There's no question we're going to see more and more COVID illness. In wastewater, it's now at a high level, so that would be, I'd say, a leading indicator. Also a leading indicator is emergency room visits. A huge increase in those in all age groups, but particularly in 75 and above and 65 and above. A lagging indicator, of course, is hospitalizations, but you can see we're beginning to see increase in hospitalizations from COVID. So what's driving that? We've talked about the variants before. As you recall, JN1 sort of disappearing, and now what we have is mostly the flirt variants. I like to show this relatedness tree because it explains it, I think, the best. Remember, Omicron was the most dominant variant in 2022. In 2023, it was JN1. And then the current vaccine is to XBB 1.5, but the new vaccines in the fall will be to the JN1 or these variants. This year, it's these flirt variants, and the reason this is important is I'm going to show you in a second. This seems to be a United States phenomenon. I think a lot of this is being driven by viral evolution in the United States because we don't have a strong vaccination program. I'll explain why. This is the travelers data. Remember I talked about airplanes and airports being tested, big spike in increase, but what are the viruses coming in? If you look at it, JN1 is still pretty high. It's disappeared in the United States, but it's high in other countries. The flirt variant that's seen is in people coming into this country is KP3. As I showed you on that, with ours, it's already evolved from KP3 to these others, KP2, 3.1, LP1. They're all related, but they are evolving. So I think this is happening in the United States. We are now the problem for the rest of the world. The TEFI data is really interesting. That's the Texas Epidemic Public Health Institute. Still a spike in echovirus 11. I mentioned that before. That's mainly a problem of newborns. Enterovirus D68 still high, which is an upper respiratory infection that gets through the gut. That's why it's an enterovirus. And parainfluenza 1 and 3, we've talked about that before, causes a pretty significant upper respiratory infection, in some cases pneumonia. What's interesting is you can see SARS-CoV-2 beginning to spike, but also Mpox. So Mpox is around in the wastewater a lot. We haven't had a lot of cases of it, but I would anticipate that we'll begin to see some cases, which are mainly skin lesions, mostly in men who have sex with men, but we'll begin to see, I would think, some cases of Mpox. Now, just a couple of scientific things this week. One is from our own Peter Hotez. Peter Hotez and Maria Elena Battazzi had a really interesting paper in one of the Nature journals. They used the same strategy they used for the SARS-CoV-2 vaccine, but added a receptor binding domains from SARS-CoV-1 back in the day and MERS. And so it was a trivalent using the receptor binding domains from the current SARS, the previous SARS, and MERS, all related coronaviruses. And what they found by doing that was they could generate broad immunity against many coronaviruses from other bat species in mice. So this is the kind of thing we need to be focusing on, is how do we get a pan-coronavirus so that we're not just chasing variants and will also protect us against potential other coronaviruses. So I think that's a really nice paper, and congratulations to Peter and Mary Elena for that. There's also a really cool paper in Science, a review paper on what have we learned about ventilation. Because unlike all the stuff we talked about, social distancing and everything, the most important thing is in aerosolized transmission is ventilation. And there were sort of 7 lessons that I thought were really interesting. The first is it takes interdisciplinary science to deal with this, of course. Physics, aerosol generation, people who look at environmental health as well as the basic science of transmission. The second thing was it's not just open a window. It's actually numbers of exchanges of air. They pointed out that there ought to be designs that are built into future buildings, and that what we did find out is that things like filters, active filtration, HEPA filters in rooms could substitute for some, or at least be helpful. The other thing that was really interesting is they suggested we develop a number of tools to actually assess levels of ventilation, that it should be monitored regularly in future studies, and then it should be regulated. So it's really interesting, and it's been beginning to say, like, we can't just leave it to every builder. We should actually be developing metrics. We should be measuring them. We should be reporting on them, and we should make sure they hold builders in the future to standards of ventilation. So anyway, why don't I finish with a bunch of shout-outs. First of all, it is the Paris Olympics. I just returned from the opening ceremonies where it was extremely wet. And I want to give a big shout-out to Jeff Schultz, a professor of orthopedic surgery, and Dr. Shauna Norman, clinical professor of pediatrics, who are in Paris to support the Team USA athletes for the 2024 Games. Also, big shout-out to Simone Biles from Houston, because the team won the gold medal, and Asher Hong from Tombold, who's helped our men's team get a bronze. Also, I had an opportunity to go to Africa recently, visited some of our programs, our Baylor Health Program, Global Health Programs, and the group in Botswana is really amazing. Our first program was launched in 2003 when we opened the Botswana Baylor Children's Clinical Center of Excellence with the support of Bristol Myers Squibb Foundation and PEPFAR. This was the first pediatric HIV clinic on the African continent, and we've been taking care of over 40,000 children in that particular clinic. We've had a big impact there, and Botswana is actually very close to eliminating mother-to-child transmission, the first sub-Saharan country to do that. And our work is now focused not only on HIV, but general public health as well as cancer, and we're trying to help that country expand their STEM programs. And I want to thank my good friend, Dr. Masisi, who's the president of Botswana, for his tremendous support and partnership. Thank you, Dr. Masisi. I also visited our programs in Malawi, where we have worked in partnership with the Malawi government since 2005. And our original mission focused on caring for HIV-infected children and families, but now we've broadened that to include pediatric cancer and maternal health services in collaboration with the Texas Children's Global Health Program. In particular, I want to thank Dr. Kumbezi Chambanda, who's the Minister of Health, for her support and our work together to enhance the care of people in Malawi, and I hope she comes and visit us soon. And finally, a giant shout out to Mike Miswa, who leads our Baylor Global Health Programs in Sub-Saharan Africa. I really appreciate all the work he's doing. I hope you have a wonderful weekend. Can't wait to see you next week, and I hope the U.S. win a lot more gold medals. Thank you. Have a great time. See you next week.